Hi everyone, thank you for joining us today. I'm Stephen Piazza, Director of Advocacy at the Canadian Cancer Society, and I'm joined today by my colleague Helena Sonea and our dedicated volunteer advocates Srini Correa and Noemi Crevier. We're here on the behalf of the nearly 1.5 million people living with and beyond cancer and their caregivers, who each and every day are navigating the treatment, symptoms, and side effects that come with a cancer diagnosis. And now, they're facing the growing financial pressures that come with living with cancer in Canada today. In 2024, our special report on the economic impact of cancer in Canada found that cancer costs the average patient nearly $33,000 over the course of their lifetime. This includes direct out-of-pocket costs like travel and treatment, medications, and side effect management, just to name a few. And it all adds up. People with cancer and their caregivers are projected to shoulder 20% of Canada's cancer burden in 2024, amounting to a staggering $7.5 billion. The fact is, financial hardship can contribute to worse health outcomes, with some opting to delay or forego aspects of their treatment. People who need to reduce their work hours or leave their jobs because of this illness often face the loss of vital income and health benefits. And the same goes for caregivers who need to take time off work to care for their loved ones. At CCS, with the support of our volunteers, donors, and partners, we do all we can to help alleviate the financial burden that comes with a cancer diagnosis. Last year, we provided transportation for cancer patients, covering a total of 4.5 million kilometers across the country to ensure they could access their treatment. We also distributed 4,000 wigs and breast accessories, alongside a range of other programs and services dedicated to people affected by cancer. But we can't do this alone. Since we launched our report, over 60,000 people and counting have signed our petition calling on all levels of government to help us lower the cost of cancer care in Canada. And today, we're here with patients and caregivers from across the country to talk to elected officials about how we could do just that. To share more about the financial impact of a cancer diagnosis, I'd like to welcome Srini to share her story.
Hello, my name is Srini Correa, and I am based out of Saskatoon, Saskatchewan. My experience with cancer is being a caregiver to my husband for almost 4 years. My husband, Eshan Correa, was diagnosed with stage 4 cancer in 2018 at the age of 25. His cancer was non-genetic. There was no family history, which happens to less than 1% of young adults. Caregiving has been a financial burden in my life as I was a young caregiver. I was in school, in university, when he was diagnosed, so I pulled myself out of school to be there for him emotionally, physically, and financially. The financial burden was great. The cost of cancer care has been increasing and has always been a big financial burden in my life. We're asking the government to make the caregiver tax credit refundable, which would help alleviate some financial burdens. The cost of cancer in my life was not just medicine or prescriptions, but it was also hospital stays, it was parking, transportation. As Stephen spoke about parking and the costs of just being at the hospital, chemotherapy. We didn't have any financial relief when it came to it from the government. And the cost of cancer average for Canadians is about $33,000, which does not cover really anything. We were low income as well, and therefore we were not able to benefit from that tax credit. Right now, I am a single mother, a widow, and the cost of living is also just increasing. As inflation and everything else is increasing, it has provided financial difficulties in my life. Further, I am now in school and trying to juggle being a widow and a single mother has further complicated for me, physically, mentally, and financially. And I'm going to pass it on to my colleague, Naomi.
Bonjour, je m'appelle Noémie Crevier, je suis résidente du Québec. J'ai eu un lymphome il y a 6 ans, donc oui, bien évidemment, comme vous pouvez voir, je suis une survivante du cancer. Je suis en rémission, ça fait 6 ans. Je dis souvent aussi que je suis survivante du système. Je pourrais vous parler de plusieurs choses que j'ai apprises à la dure en me battant pour ma vie. Mais au-delà de l'aspect médical, il y a un autre combat, celui des coûts. La Société canadienne du cancer, qui estime là, le 33 000 ça vient pas de nulle part. Je peux témoigner de mon expérience personnelle que les coûts s'accumulent très vite. Les transports, le stationnement, les médicaments, mais simplement adapter son quotidien à un corps qui change, la perte de revenus. Dans mon cas, je suis encore aux études. J'ai fait une demande d'assurance maladie qui a été refusée. Il me manquait seulement 40 heures pour être admissible. Heureusement, j'habitais encore chez mes parents. Ils ont pris en charge tous les frais imprévus. Manqué plusieurs journées de travail, puis dû réajuster leur budget. De mon côté, je voulais garder un minimum d'autonomie que je venais à peine d'acquérir, comme j'avais seulement 21 ans. J'ai donc continué à payer certaines de mes dépenses, des frais courants qui ont résulté à la perte totale de mes économies qui représentent plusieurs milliers de dollars. Puis, encore une fois, ça ne comprend pas tout ce que mes parents ont dû débourser de leur côté. Mais comme, en fait, je suis aussi, j'ai été aussi témoin de la même chose qui est arrivée à plusieurs de mes proches. J'ai été aussi une proche aidante. J'ai aussi une amie qui avait à peine 20 ans, qui devait jongler entre ses études, un emploi pour aider à payer les factures pendant d'être proche aidante auprès de sa mère parce que son père devait continuer à travailler pour ne pas perdre la maison. Donc, au final, peu importe la situation de départ, le cancer frappe soudainement, puis son impact économique est simplement inévitable. Aujourd'hui, trop de proches aidants ne peuvent pas bénéficier du crédit d'impôt naturel pour proches aidants. Pourquoi? Parce que ce n'est pas remboursable. Ceux qui arrêtent de travailler, ceux qui réduisent leur heure, ceux qui en auraient le plus besoin, sont justement ceux qui ne reçoivent aucun soutien. C'est simplement un non-sens. C'est pourquoi, comme les 60 000 Canadiens qui ont signé la pétition, je demande à rendre le crédit pour aidants naturels remboursable. On ne peut pas tout régler d'un coup, mais on peut au moins alléger ce fardeau énorme. Puis je vous le dis, quand le cancer va venir frapper à votre porte, pour vous ou un de vos proches, ça va simplement être une chose de moins à gérer. Merci.
Thank you so much, both of you, for sharing your story and being here with us today. Je suis Helena Sonea, directrice de la défense de la public à la Société canadienne du cancer. Nous sommes ici au nom de quelques 1,5 million de personnes qui ont une expérience du cancer, ainsi que de leurs proches aidants. Chaque jour, ces personnes doivent composer avec les traitements, les symptômes et les effets secondaires liés à un diagnostic de cancer. Aujourd'hui, elles doivent aussi faire face aux pressions financières croissantes qu'entraîne un tel diagnostic au Canada. En 2024, notre rapport spécial sur les répercussions économiques du cancer au Canada a révélé que le cancer coûte en moins près de 33 000 $ à une personne qui en est atteinte au cours de sa vie. Ce montant comprend les frais directs déboursés occasionnés par les déplacements afin de recevoir les traitements, les médicaments et la gestion des effets secondaires, pour ne nommer que cela. But it doesn't have to be this way. Every government has a role to play to alleviate the cost of cancer for patients and caregivers. There are things that the federal government can do right now in this upcoming budget to make a real difference in people's lives. Specifically, we're calling for the Canada Caregiver Tax Credit to be made refundable. Currently, the federal government offers a tax credit to support caregivers with these costs, but it is non-refundable. This means you can only get money back if you pay enough in taxes, but if you're no longer working, you don't earn enough money to pay taxes, so you don't actually get any support. This is especially concerning as economic instability grows and caregiving demands increase due to our aging population. Research shows investing in caregivers reduces emergency department usage and demands for long-term care enrollment, and it makes it easier to care for caregivers to care for a loved one in their community. This move would be a targeted measure to help get people ahead and put more money in people's pockets. The Canadian Cancer Society has a long-standing history of supporting different governments and enacting change. Cancer is the leading cause of death for people living in Canada and causes enormous costs to the Canadian economy. Health policy has an enormous impact on people's experience of cancer. There's a lot we can do to save and improve lives. We are pleased to be here on Parliament Hill today to enact this change together. Thank you. Merci.
no reporter online for ask question. If you want to add something else, you can go ahead. Nothing to add?
No.
Okay, well, conclude the press conference. Thank you.
Merci.
Thank you.